Today on CCHF Talk.
The best way to combat a culture problem is by actively and intentionally building a healthy one. And that the minute you stop actually and intentionally building one is when it goes back down.
CCHF Talk is produced by Christian Community Health Fellowship, where healthcare providers, executives, and students come together to educate, encourage, and engage. Join us as we explore topics related to healthcare to marginalized communities. Those talks, those conversations. CCHF Talk.
Thank you, everybody. I'm so excited that everyone's here to talk about staff culture, which is one of my favorite subjects and one of the hardest. So with that, let's open in prayer together. God, you are a God of love. And Lord, we are here because we want to love your people and we want to love your people well. Lord, and as we think about our communities and our patients, our people are also those that work alongside us, that work in our organizations, Lord. And I just pray that you use this time to help us steward that gift of their servant hearts, of their love, of their talent, of their skills. Help us come together as we think about how we create spaces in which people feel like they are a piece of this community and can do their best work, Lord. We give you this time and ask that you meet us here. In your name we pray. Amen. So my name is Breanna Lathrop, and just by a quick way of introduction, I am the CEO of Good Samaritan Health Center. This month is my 15-year anniversary with the organization. Yay! I love it so much. We are in Atlanta, Georgia, and we are a charitable clinic, and we are hybrid. So we do see Medicaid, Medicare, some private insurance, but we're about 85% uninsured. I think sometimes it's helpful just to have a background where people are coming from. And I still consider myself somewhat new to the CCHF community. This is my 5th conference, and I continue to love it more each time I'm here. And I do get to serve on the board of directors right now for CCHF, which has been an incredible gift. So with that, let's talk about staff culture. And I want to start with my no financial disclosures. And then I added a second disclosure that is that I have not figured it out yet. And so I just want to make this an open opportunity that you could still leave. You could probably still get in the doors of another session. So if you are hoping that I found the way to keep and retain just a thriving, positive staff culture, I think it's a daily task, right? And it's something that we continue to strive for and we continue to work together. I'll also give you a warning that I really want this to be interactive because we learn best when we share with one another. Also, it's 4:00 on Friday afternoon. So I'm going to do a little bit of ground setting and some information sharing. And then in our second piece, I'll kind of have you gather up with folks around you, just kind of in your seats, so that we can do a little bit of sharing and group brainstorming around this as well. So first test of our interaction, why does staff culture matter? Just shout out words. These don't have to be fully formed thoughts. Morale, retention, efficiency. What was that? Productivity. Quality of care, mission, patient satisfaction, work-life balance. These are great. Oops, sorry, was that last one? Repentance. Awesome. So when I thought kind of about what does this boil down to for me? When I think about why does staff culture matter, I kind of thought that most things ended up in kind of one of two categories. One being patient outcomes. And so we can talk about that at the end of the day, most of our mission statements have something about delivering care, right? And we want to see our communities and our patients become well. And this encompasses a lot of things, including productivity and satisfaction and all of those things that make up what do patients experience when they come to us? And are we offering quality care? And the second piece, as you all said as well, is that aspect of our staff's well-being and spiritual growth, that connection to our mission. And so when we think about the culture, it's also about what is the experience of those who join us. And for not all of us, but many of us, our mission statements also have that piece, right? It is about the who we are as followers of Jesus Christ that motivate the reason we do the work that we do. And that is our culture. But it's not always easy. Because I looked ahead of time and I saw that this session got accredited for CME, I thought, oh, I should add some evidence-based resources to this topic. So here's that slide. But, we know these things, right? This isn't new information, that when we think about staff culture, when people are satisfied with where they work, if they enjoy their workplace, if they feel engaged, connected, lots of different words get used in the research. But research tells us that there's increased patient safety and decreased error risk. People feel more comfortable sharing when a mistake gets made, solving it together, remedying that situation before the outcome becomes worse. It also means that engaged employees are more likely to make patients feel respected and cared for. This is huge. This means that when patients feel respected and cared for, they are more likely to come back. They're more likely to be honest about what's going on. They're more likely to connect and share their stories. That's certainly linked to increases in patient satisfaction. Overall, it's linked again and time again in the literature around higher quality care. We know these things, and I think I've known them for a while, but what has been really helpful to me is to think about, what does that mean for Good Samaritan? How do I see that living out in the clinic where I work? And so I want to share with you, and then we will talk really specifically for most of the sessions about really practical tools around building culture. But I want to share with you some research we did that really just solidified my understanding that the most valuable asset in our organization is our people. It helps to have a building. We need supplies. We need all that. But at the end of the day, the who of who is delivering this work is what really brings the mission to life and is what changes the lives of our patients. So a little bit about Good Samaritan that's helpful to understand the research study I'm going to share with you next is that we opened in 1999. As I mentioned, we're a hybrid charitable care clinic. Patients pay on a sliding scale, and we do have about 20% of our patient population that is a no pay. We did almost 39,000 patient encounters a year, and we have 59 employees that are employed versus volunteers. And we do have volunteers as well, like most of the charitable care world. And that picture here shows our model of care. We do medical care, not surprising. We also have dental care. Our dental takes up half of our building. So we're actually very much as much medical as we are dental. We have a farm. We have 2 full-time farmers on staff. We have a farmer's market that's open 3 seasons a year. We have a YMCA. We have a teaching kitchen. We have counseling, psychology, psychiatry to make up our behavioral health. And we have a YMCA on site. So we really think about ourselves as a health clinic versus a medical clinic, and really thinking about some of the challenges that we face with staff culture is that the needs and lived experience and the day in and out of the job looks very different between a farmer to a dietitian, to a medical provider, to a dental assistant, to somebody raising the funds. And all of those people are needed to do this work. And so how do we create a culture around all of that? So in 2015, we noticed that the percent of people that were reporting that they were experiencing homelessness had been on a slow decline. And we asked ourselves, is this a problem? So there's a few possibilities, right? One is that the percentage could just be decreasing in Atlanta. That would be a good thing. Another is that other organizations are doing that well, and it's not the need we need to fill. Or the third is that there is a need out there and we're not meeting it. So we went around and we started asking trusted partners that worked specifically with this population around the healthcare access and what was available and what wasn't. And while there were certainly partners doing great work in the community, there are a few key barriers that kept coming up consistently in terms of what was really preventing this population from engaging in consistent healthcare, and particularly the idea of coming back versus just an ER visit or an urgent care. And what we heard was that it is really difficult to have a scheduled visit if you're not really sure what tomorrow looks like or where you'll be or how you'll get there. That it was really discouraging to have to keep jumping through hoops to see okay, before I can see a mental health provider, I've got to do primary care, but I don't really have a primary care concern, or my tooth is abscessed and I don't really feel like talking about anything if I'm in pain. Other things we heard about were that people didn't know how or where to go to care. They didn't feel like there were trusted or safe places. So we took all this feedback back and we discussed as a staff and said, well, what if we just tried something completely different? We operated fairly consistently. We're a patient-centered medical home, and a lot of our patients are scheduling consistent appointments. We certainly do walk-in care, but it had been mostly established patients having sick visits. So we said, okay, let's just try for a month or two. Let's just designate one Friday a month, and we'll just have absolutely no scheduled visits, and we'll just be fully open for walk-in for specifically people experiencing homelessness from any and every one of our partners or anyone that finds out about us. And within 3 months, we had moved to every Friday. And we kept building the program. So we had partners. We had a nurse, a retired nurse that ran one of the largest AA meetings specifically for people experiencing homelessness, was picking up people in a van and driving to our clinic out of a van. And we created a loop that went through several of the major downtown shelters and a park where we found the most of our patients that were needing those services were sleeping. We made dental also equally accessible, fully walk-ins available, and then had ability to schedule on Fridays when transportation was available for longer procedures as well. We integrated behavioral health. Then we started adding, we heard from our patients that they were making the choice to come here instead of where they would normally get their meal in the morning. So we started adding a hot meal to the clinic. We started packaging care packages and continue to tweak those based on what people tell us their needs are. And it has become really ingrained in the culture of our organization. And as I had been planning for this, I had been thinking, I've got to prepare the staff to leave a very medical home model mindset to think more acute care, right? And more like triage and move on and triage and move on. After a couple years of doing this, we found that we were running about a 70% follow-up rate on just specifically this clinic. People were getting mammograms done. Their colon cancer screening rates were rivaling the colon cancer screening rates that our clinic had before. And people were on insulin. And I was just overwhelmed that what people were seeking was consistent care, that they wanted a medical home, and they were fully engaged in that. So we asked our question next, why? Because as we thought about how do we build from this or learn from this or maybe expand that, it's essential that we understand the why behind what is driving that 70% follow-up rate. So we are fortunate to have a CDC researcher volunteering with us at the time, and we're in Atlanta, so there's a lot of students. So we were able to, through a student, get some IRB approval and set up a qualitative analysis that was really seeking to determine what drew people to the clinic in the first place, which aspects of our full circle of health model were most vital to them, what did they value, and identify the factors that we could improve upon. We were really interested in this larger picture of what keeps you coming back. Because if patients don't come back, we don't have time to continue to build those relationships and live out our mission and improve outcomes. We had pre-established questions. So these were all open-ended questions. Then we had a student researcher that was in the room with patients so that there was completely blinded from anyone that was delivering care. The student was an MPH student that was not otherwise involved in the organization. And we had crafted these questions in an order and what to, where on the flow chart to go next, depending on the answer. I put a few of these questions up just to give you an idea of what we were asking. We would say, tell us about the first time you came to Good Samaritan. Just tell us what it was like. What services are most important and why? What changes have you seen in your health? We ended up interviewing 20 patients. That was based on a planned saturation rate of about 18. And then three of us reviewed these independently from the transcripts, and then we did a multi-pronged thematic analysis. But all that to say, let's get to the important part. So we found about 5 themes, and I'm only going to focus on 2, because again, I want to spend most of our time talking about the strategies or the steps that we use to build culture. But this changed everything I thought I knew about healthcare. And I could have quoted the statistics on why it mattered about employee satisfaction and why people are important. But on a questionnaire that didn't ask at any point, did they like the staff? What were their interactions with the staff? We just asked open-ended questions about people's experience. And the 2 most significant themes that I'm going to share with you was first this theme around dignity and respect. That 12 of our respondents specifically said that their main reason for coming back to Good Sam was that they felt they had been treated with dignity and respect. And y'all, I went into that and I thought the main reason was going to be that it's free. The main reason is that maybe there's a meal. The main reason is that we give the medicine at the time of the visit, also free, and there's no follow-up required. But that wasn't why people came back. And people, they used words that fell in this theme were like, I was treated like a person. They really care about me. They remembered me. I felt respected. I just pulled a couple quotes because these, when it is a hard week and when I feel like we are failing, these are the quotes that I read over and over again. You are not just a patient here, you're a person. Other places I've gone to, you're just another number. I found myself coming back to familiar faces and people that didn't point fingers or discriminate. For someone to treat you as equally important means a lot. Now, the second theme was that, again, we didn't ask anything about staff, is that 8 people specifically used the word friend or family in their response. And the only way that we would take quotes to fit this theme is if they chose to use that word specifically on their own. That 8 respondents said that the staff at Good Sam had become their friend or had become their family. A few quotes that illustrated this was, I love the staff. This is the best clinic I've ever been to. Not only the support, but I can consider them as my friends. You can just speak and have a little conversation and feel like these people really care about me, feeling that you matter to somebody, no matter what your circumstances or where you're coming from. Sometimes, certain times of the year, not only the anniversary of my wife's death, but also holidays without your family, and you don't have the support of a family that you want. Sometimes this, Good Sam, is my family. I was able to sit down with my doctor who's become a friend, who has looked at me not as a broken man, not as a homeless man, but as a human being. And this study for me just really connected me that at the end of the day, it was not going to be how many more visits I could put into a Friday, or that it was how many more services could we integrate. Or how more efficient could I build the clinic? And all those things do matter. We can't ignore productivity, efficiency, or any of that. But that if we lost the people that were showing up and being the friend, that were remembering someone's name, then we had lost it all, right? And it shaped my thoughts on what it meant to be a good leader and what it meant to build staff culture. So that second piece, that also comes from this then is our mission. And for many of the clinics here, and I know we do have members among us that are working in secular clinics as well, but then for them, many times their personal mission also revolves around our ministries as followers of Jesus Christ. And that I think that this can be an extra level of challenge with staff because our staff come from huge walks of life in terms of their faith journeys. Staff also carry trauma that they have felt from the church or from religious upbringing. And if our workplaces become places that feel like just overwhelming places of stress and defeat and hardship and judgment, that can also do damage to people's spiritual walks and trust of the church. That is a huge responsibility, and sometimes it is not a fair responsibility. But I think that when we say this is our mission and this is why we do this work, then we also say that it is that much more important that we lean into these truths about that it matters how people feel. I don't think any of us needed that to be convinced that culture matters, because you're all in the room anyway. But I do think that whether it's conducting a study on your own or finding something that anchors you to that memory, because it is not easy. Do any of you know Marty Hiller? Okay, so Marty is like one of the pioneers in the free and charitable world. And like if you're in a free and charitable clinic, there's a good chance that Marty or someone Marty trained helped you open your clinic. But I was on a call one time with Marty, and he was like, running the health center would be easy if there wasn't any staff. I think all of us can resonate with that, right? Like sometimes the hardest part of doing your job are the people that you work with. Or if you're in any kind of management or leadership role, that is often the most challenging piece and the most important piece. And I think that tension is difficult. And it's not just us. These statistics are alarming. The Gallup poll, we actually use it as our our employee satisfaction tool at the end of each year. The nice thing about it, you can see how you compare to this being used nationally. But then employee engagement is down to the lowest it had been in a decade, with 31% of employees reporting that they feel engaged at their job. The most significant drop is in our young people, 35 and under. That's hugely problematic for our future growth and leadership. And the largest drops were in these categories. People, if you've ever taken this, it asks you to rate on like a Likert scale from 0 to 10, how much you identify with this. So there's one that's, I feel that my job expectations are clear. Feeling that someone at work cares about them as a person and someone encouraging their development. Those are the biggest drops that the Gallup poll has been consistently seeing. And oddly enough, they sound a little like the reverse of the results from the patients, right? That our staff want the same thing our patients want. They want to be seen. They want to be known. They want to be valued. Burnout in healthcare is at an all-out high. 54% of nurses and physicians, 60% of medical students and residents, 61% of pharmacists, 54% of clinical staff that are non-provider, 45.6% of non-clinical staff but that are in clinical setting. These aren't new statistics to most of us either, but this means that when we are working really hard and it still feels like we're not building culture, that we remind ourselves that we're coming back to a lot of brokenness. That a lot of people are coming in already exhausted and already traumatized and already with their defenses up, that maybe this won't be better or maybe they don't belong here either. So we're starting to get into the interactive part. So to warm you up, just word clouds here of what threatens a positive staff culture in your clinic. Gossip. Any others? Complaining, silos, turnover, change, lack of transparency, communication. Yeah, clarity of expectations, time's a big one. Feeling unappreciated. And it's hard to fix bad culture, right? So I often think that the best way to combat a culture problem is by actively and intentionally building a healthy one. And that the minute you stop actually and intentionally building one is when it goes back down. I usually think of staff culture as its inertia is that it just keeps moving to worse unless you're actively doing things as an organization to make it better. Anyone else feel like? I see some head nods. And I think that's human nature. That's the brokenness of who we are as sinful people and the brokenness of our world. It's not easy to do this work. It's not even easy to just make it through day in and day out and raise families and have friendships and navigate the complexities of everything we're up against. So what I want to spend this time with, and I want and hope that all of you are up for some participation because you all have ideas, I don't too. But I'm going to work us through just a few categories of what I took themes from research about what we know makes people feel better about their workplaces. So these themes are drawn from research. But then I think what's hard is that a lot of times we can talk about the themes and you can be like, that sounds great, but what do I do? What do I implement tomorrow that changes that? And that's what I actually want to dig into now. So I'm going to put a few themes up there, and they're not all the ones that matter, but they're ones that I think are really good starting places. I'm going to start with some that feel like a little less nebulous and easy, and then we're going to end with some that feel like a little tougher. And I'm going to have people just cluster, I think groups of 4 or 5 just around you. And what we'll do is we'll kind of do 1 minute, when I kind of name, you'll see in a minute, I'll kind of give you a prompt question. Just shout out if they're to each other, if there's been something that's really worked for that in your clinic. And then if there's one that your group is ooh, that's cool, I'll have you kind of pop out a few to share with the group. I'll give you some examples of things that we've been working on and that we've learned from as well. All right, so let's start with connecting to the mission. How do you help staff members connect and stay connected to the mission of your organization? So gather amongst yourselves, 4 or 5-ish people. I'm watching the clock. All right, so if you kind of finish that thought, you're on. And then if any group would like to just shout out if there's anything that really resonated with that group, I'll repeat it into the mic so that we can all hear. What did groups come up with? So just in case anyone couldn't hear, memorizing the mission statement and then getting an award, if you could memorize it, incentives. And then the other was being able to get awards for the core values. You could get the Unity Award for the organization. Other cool ideas people heard from their discussions? Yeah, the visibility of your mission statement. Yeah, great. So that was tying annual review to the actual values in that mission statement. Also goes along with expectations. So just a few things that have been really helpful for us is I think I'm reminded again and again not to just assume people know the mission statement because they got hired or because they decided to interview with us. That we spend a bit of time just going over the mission statement and what it means from the first interview to the second interview to the first day in the onboarding. We also have a really robust onboarding process. So our onboarding process, the first day that you're at Good Sam, is actually not even in your department. There's some HR stuff that we cover, of course, but we also have some modules on health equity that we've built and our employees go through to understand the community we serve and some of the barriers faced. We also have, they get like a full tour of the building, and we do as many one-on-one face handshakes, introductions as possible during that time. We have also leaned in a lot to storytelling. So for example, at least every other year, we have our founder come to our staff meeting and just share his story of what it meant to start Good Sam in 1999. I think why that matters is that as you bring on new staff, you sort of forget that they don't know that story just because they show up to work every day. And even if you've been there for a while, reconnecting to that, like, man, what was it like when there were like 3 employees? Like, how much work did it take? What was the vision of those early founders? And that people like stories. Like a staff meeting where someone's telling a story, people are like, okay, yeah, this is much more exciting than OSHA. Certainly, we do a daily devotion. I think a lot of clinics have a practice of having a time during the day where they connect. My favorite thing about our devotion is that everyone in staff rotates through. And I have just loved hearing the words people put to their faith. We also have just a lot of different denominations and different languages in terms of how people have experienced faith. And it has enriched my own, and I think is a real gift to get to experience Christianity through all the many lenses that it exists. We also pray for one another during that time. And one thing that we have set up too is that for a lot of people, they're very connected to our mission, but the idea of praying with a group, this is brand new for them. And so we've set up mentoring where for their first devotion, they can do it alongside someone that's been working for a while. So they feel like someone's supporting me in doing this. And it becomes just another avenue of that connection. And then another thing that we really started to work on from our own learning about the clarity of expectations and that rate on our feedback is really revising job descriptions regularly and having the mission incorporated into that job description. I think a few things that I have learned, and again, often I like to say like a lot of my learning has been by just like not doing it right the first time. But that if it is critical to your mission, so for us, that prayer and devotion time, then it needs to be paid and protected time. So we do it at the first part of the day, and employees report at 7:30, and it's 7:30 to 7:45, and then patient huddle is 7:45 to 8. Everyone can clock in for that time. There is no patient care. The door doesn't even open. No one is assigned to early open duty. The doors open at 8:45 when we all go down together and start registering patients. That part of sharing our story and that storytelling is to share the successes and share stories of how our mission gets lived out. So like when we did this study, the first people that heard the results were the staff. We just said, hey, here's what we learned, guys. We hadn't even had time to process what that would mean, but the first people that should hear that information should be the people doing this work. Create spaces for diversity of walks and worship. So our medical director plays the violin. Most of her devotions include a violin song where we all just listen and like meditate on the beauty of that. But we've had people lead prayer in the language that's their native language, because you should be able to pray in the language that you talk to God in. And that has enriched our faith as well. Taking moments to connect the daily work to the mission, being like, hey guys, this is what we're launching. We just started men's clinic at the satellite clinic. This is why that is a mission-driven program. Because it's easy to start just thinking these are tasks and these are to-dos, especially if it's not your department. And then thinking about, hey, the farm added honey. Like, why does that matter for our mission? And like, why are we excited about that? Incorporating those conversations have been really helpful. All right, next one. A big thing on the Gallup poll is, do people feel recognition? And y'all, recognition matters a lot. So getting back in your little groups, 1 minute on the clock, what are some ways that you've developed to recognize employees for the work that they do? Go. All right, if you'd wrap up the thought you're on, I know a minute goes fast. All right, so let's gather back. And this one sparked a lot of good conversations. I'm excited. Any favorites that you heard? You could also share something that like your neighbor told you that you were like, that's the coolest idea ever. You don't have to name them. You can share on their behalf. All right, I see you. That's awesome. So an employee of the year that comes with like a whole party. That's awesome. Other ideas that were cool and maybe new, exciting to you? Yeah, the idea of using your social media also to garner additional support and excitement, even from outside the immediate community. Yeah. So again, these are a few of our very practical ideas so that you can take and borrow or modify to fit your work culture. But we do Wednesday kudos. So if you're in charge of devotion on Wednesdays, you're in charge of making it a short one. And then these are peer-driven. We have kudo cards that you can get off Amazon that prompt people to like share a little message. And I love it because it's peer-driven. So anyone can give a kudo to anyone else. And we get everything from just seeing some good work they did to someone that like helped them like make their dinner that night. Like it can be in or out of the clinic. And one thing we had noticed from our employee feedback is that recognition from leadership does matter. And so what we've done with our leadership team is be very intentional about like showing up to Wednesdays prepared with kudos and to make sure that our kudos reach across departments. So like if you're in medical, you're going to find someone in dental, or you're going to talk about the farm or the wellness team to promote that. Another fun thing we started a couple years ago that's been super popular, we love VVOPs, which is just a live polling. So like Mentee's another big one, any of those. But the idea that you like put your QR code up and everyone scans it in the staff meeting. We do a birthday cloud of praise. So we put the person's name up and we're like, give us words that describe that person. And then it makes this beautiful word cloud that we see live together. And then we print it and we frame it. And so then each year on their birthday, they get this cloud of praise that's like words that people have used that really speak into them like, this is who you are to us. But we also started doing an anniversary recognition. So on the month of each year, your direct supervisor fills out this kind of prompting about how you lived out the mission, one way you've really grown. Last year, our bonus question was like one fun thing about that person. This year's bonus question is give us a quote or a song lyric that makes you think of this person. And people have really enjoyed that. And it's also a way to get to know each other. We've also started live polling. After the first year we started doing annual employee satisfaction surveys, we wanted to understand, like, for people that weren't feeling recognized, why not, and what recognition mattered. And I'd encourage you to think about doing a survey or a live poll to understand what recognition looks like for the people in your organization, and so you can build that into your culture. I also, as a CEO, I do a monthly email that recaps just the highlights of the clinic and what you should know and what to expect. And then I intentionally do kudos from each of our departments so that people are seeing their names and seeing recognition. And then our newest, this is generated from our Patient Advisory Council. It's the coolest idea ever, but they wanted to nominate people. So we've just set up for the first time a place where vendors, patients, community members could put in a note. You know, we've had a comment box, but everyone knows a comment box is for like the things going wrong for the most part. And this is specifically going to be like, here's a moment if you just want to say thank you and name a staff member. And then we'll be sharing those out loud at our meetings. I think a few key points is that recognition is best when it's personalized. And so finding those ways that help them feel like this is for me, this isn't just like good job department or way to see patients, like when it's personal to what they do or who they are, that it matters from all directions. That we think about how can we show recognition from leadership, how can people feel recognition from their peers, and how can people feel recognized by the ones that they serve, whether it's patients or their vendors or how they work. It needs to be regular. What we've learned from our employees' feedback surveys is just being recognized once a year on your anniversary, 6 months into a really difficult year, no longer feels like any recognition. And so finding ways to keep it fresh and new. And then maximizing natural moments of celebration. So when we have a new opening of our satellite or when it's the opening of the market, we've started thinking about, even if it's a donor-facing announcement or event, how do we make it special and inclusive of the staff so that staff are celebrating those milestones? All right, here comes a toughie. How do we think about compensation and benefits from a lens of staff culture? Would you like to discuss amongst yourselves? I expect way less talk for this one, but let's give it 1 minute and see what happens. All right, I know that was quick, but I do want to get through all of our little sections here. So I think the tricky part is like that that does matter, right? And you can be a mission organization and people can be really driven and want to be here, but they still need to take care of their families, right? And they still need to pay off loans, and they still need to feel like if they are going to work this hard and go home exhausted, that like there is compensation from that. And I think suggesting to people otherwise is really, really damaging to culture. And I know this is a little controversial. You can take it out on the evaluations and I'll be okay. But I do think that because of what we do and who we are, we need to guard against that. That telling someone that they should be mission driven and not expect to be compensated can really, really hurt in ways that will damage our sector for a long time. I'm going to go one step farther, and I'm going to say that if part of our goal is to say that we want to recruit people from our communities to do this work, and if we want to raise up a generation of healthcare providers that look like the patients that they're serving, because we know that matters for outcomes, and we are going to say, you can do this and you should be paid less, that's a problem. Okay, now, I was waiting for it to make it. No, so I also know that that is not always possible on day one, and that there are clinics that started like mine with 4 employees, and they're all part-time, right? And so it is okay to be in a spot that's not ready for that, but if we lose sight of that as we grow and we fundraise, and that's not part of our model of how we do care, then we will find ourselves 50 employees deep and in a lot of trouble and doing a lot of hurt and damage, and having people not just leave our clinic, but not thinking about working at a clinic like this. My goal is that if someone walks out of Good Sam, that they are walking to one of your clinics, right? Like, I'm okay because they're going to be in this movement, right? And that's, to me, where we have to be serious about these conversations. A few strategies we've used is we've been super intentional about financial transparency. We dedicate a staff meeting each year where our director of development comes in and lays out what the year looked like, where the money went. She explains the difference between operational donations and capital donations, why you could build a building and still be struggling to pay employees. Again, we are a budget of 80% fundraised, which I know is not the case for most of the FQHCs, but still, even just showing like where's our revenue coming from, what makes a hard year, what made it a good year, helps staff understand as we make financial decisions where they are coming from and that they're not based in their merit and value as people, and helps us do it as a community to say, hey, if this was a tight year, what are we doing about that together to try to do this as a community? I love that. A few other things we've done is that for hourly staff, we did move to a living wage model. So we said, what's the living wage in Atlanta? And that is where we will start hourly employees. And we started telling all of our donors that, and we put it in our capital campaign, and it's on all of our literature. So instead of we told our donors, we were like, you want to do equity work, you want to build healthier communities, then it starts by making sure that we are representing the employers we wish our patients had. And if you're not willing to help us on that journey, then you're not really about our community or our patients. It's been very well received, and that has helped us. We gave ourselves on a 5-year strategic plan 5 years to get everybody at a living wage and sustain it, that no one will be hired under a living wage moving forward. And then I think the other piece of this is to think that sometimes benefits aren't compensation, and that especially in tight years or in really tough spots, that sometimes those are the ways that we help people make sure that they can feel connected and valued when we can't offer, the 3% raise at the end of the year, which doesn't always happen, or at least if you're in the free and charitable world, it's not. One thing we do is block scheduling. So because we're open 6 days a week and we're a small staff, we need everybody to work every other Saturday to make that happen. And what we do in return is that on your off weekend, you're off Friday, Saturday, Sunday, Monday, which really gives the space for people to truly unpack. And it has made people not afraid to work every other Saturday, and they can use a lot less PTO to build in more time off for family. But we've also done things like, because we have a YMCA, we said, hey, if you're running a whole YMCA and we have 59 employees, can they just work out free if they're at this location? No big deal, right? It's an easy ask. We Connect is like a mental health peer support app. It's costing us $40 a month to make it available for all of our employees and their entire families. And so looking for things that are just like wins that help people access or have resources or take something, a line item off their personal budget, are also ways to think about just being creative about how can we use what we have, especially when it feels like we don't have the money to do it. Again, just tips are, I think it matters that staff are educated about the bigger financial picture of the organization. And I think that it takes more than just making sure those documents are available to review when people want, but actually saying this is important enough that we're doing it as a staff meeting. Developing a framework for talking about pay with funders. Our development team can talk about the work of our hourly employees and why it matters and why philosophically we believe in a living wage. They're raising the money. If they can't have those conversations, how are we going to convince donors to join us? And seek solutions that help staff feel seen, because small benefits can feel big. Those little things that you can do along the way while you work towards the bigger things can build culture. We're not going to talk around amongst ourselves for this one just because I want to get to them all. Okay, sorry about that. But opportunities for growth are another factor in the literature that really show that people that keep people in their jobs longer. A few of the strategies we've used is that we do continuing education money for all employees. And I have patients take a language course. I've had people apply that to their academic tuition. It's not a lot of money, but it helps us communicate that everybody's growth and development in this organization is valued, not just if CE is required to maintain your license. We also look for like small opportunities for people to try something new. You know, if we have a grant that wants like a coordinator position into it, we try to say like who on staff is looking to grow and like how could we give them this to try in a way that's not a whole new position? Because you know, in an organization of 59 people, we don't have a whole new position when people get ready to take on something new. We also do staff meetings once a month, and we commit to having 2 staff meetings a year that are just about a topic that will benefit the lives of our staff. So we've done several on financial literacy. We did one on credit cards and what to do about credit card debt and how to manage and prevent that. We did one on how to buy your first home. And again, we got these free because we called up the bank that we bank at and we said, if you'd like us to keep keeping all of our money here, how about you send one of your community outreach liaisons to our staff meeting? And they did. And regularly assessing the needs and goals. And this is where we found we were doing a poor job. And so we really we restructured kind of our employee evaluation process to look a little more deeply at having people tell us what they need and then identifying if there were themes within that. Again, using grants as opportunities to write in for development. I regularly look for like larger grants and then section off a piece that says, also, to do this well, I need 3 employees to go to this training or this certification. That's how we help fund that. Include growth goals as part of the review process, and then identify ways for team members to be in the community. I have found that, I'll tell you a secret about myself. I don't love health fairs. Like the idea of just taking a bunch of blood pressure and then be like, please, please, please do something about that. They're not my favorite, but some of my staff love them, right? And so what I've done is we've created these protocols to make it really easy for staff members to take turns being the ones to get to go somewhere. Or we had a local school that just wanted like a healthy living presentation for their kids. And one of my MAs that's got a background in early childhood development and is transitioning in her career was able to do that. And so those opportunities matter as well. In terms of evaluation, you know, we at Good Sam, I made it most of my career having never had a formal evaluation. And the problem was that we started super, super small. And so it was one of those situations where all of a sudden we were 50 employees in and had no structure for evaluation. It matters. People don't have a sense of security if they're not getting feedback that it's going well. And then intentionally checking in. What we did with our evaluations is managers were like, if everyone wants a monthly check-in, I won't get any of my work done. What do I do? Well, we found out that if we asked during the evaluation, most employees didn't want a monthly check-in. They told us, like, could you check in with me halfway? Or actually, I feel great with the check-ins we have naturally in the hallway. I don't need something more. And that way, the few people that were like, I'm feeling super insecure and not sure I'm meeting expectations. Could we meet monthly for a while? Became a lot more possible. I'm a big fan. We use this in patient care. We ask people for what they need, right? So like we can apply the same principles to our employees and say that what one employee needs to feel safe and secure in their expectations doesn't always match the other. Evaluation should always include praise. Tell people what they're doing good first. Connecting the work that they're doing to the mission. We include self-evaluation and goal setting as well. And with my two favorites, influence. So research, in my other side of my life, I do a lot of research around social determinants of health. And one thing that's really interesting about employment is the link between employment and health outcomes is less about whether or not you are employed and more about the type of employment. And you know what the number one driving factor is? It's that work that has high expectation and very low levels of control are linked to the poorest health outcomes. So what that tells me is that if I'm about patient health outcomes, and I care about the health outcomes of employees, is that I need to make sure that people feel a sense of control and influence around what happens in their day-to-day lives. One way that we've done this is we do live polling in about half of our staff meetings. So anytime we're making a decision, whether it's we're picking the health insurance plan for the year or we're starting a new program, we have a few questions that we live poll. The other thing I love about live polling is it shows people the responses of their peers. So they can see how difficult sometimes it is to make a decision, that sometimes everyone's on the same page and sometimes there's a lot of diversity in what people feel and think about a topic. We involve all staff in strategic planning. We started as the board and then we craft kind of a actionable piece and we have a facilitator come in so everyone's involved. We also do department meetings in which we have departments use a similar framework to say, we love the Post-it note activity where we say, okay, if we're going to improve something, everyone stick on the wall every idea you have, no matter how outrageous. Even if it costs $1 million, stick it up there. Then we divide it into categories like, these are all around this theme or this theme. And then we say what's actionable from that. Totally free, except for the cost of the Post-it note. And it's highly effective. So if you don't use the little Post-it note exercise, I recommend it. For provider scheduling, we tell providers how many patients should be on a day. And then we let them choose the time and the order and where they want the walk-ins. So they have the complete flexibility. As long as it equals our number for the day, they can do it however they want. And that's been hugely popular and has decreased resistance to setting kind of targets for patient care scene. And then we do an employee annual feedback survey. These I think I covered pretty well. Oh, sorry. I just realized lots of people were taking pictures. That was my bad. But be intentional about making time and planning for input. And another caveat here that I just want to say is if it is a decision that there is no room for feedback, don't ask for feedback. Because there is nothing more harmful than getting a bunch of feedback and then everyone seeing that you use none of it. And very last one here is belonging. But just like at our beginning when we talked about our patients and how they felt, our staff also want to feel like they belong. They want to feel seen and known and cared for and treated with respect. A lot of this is around good communication. And I have learned as a leader, and I'm still learning, that what I think is good communication is not enough communication. And that it is my job to communicate in multiple ways. That just because I tell everybody to check their email, that it is not reasonable to think that everyone develop a really good system of checking their email. So we're in construction right now. And so every day people are doing different things on our building. And so we created a group meet, and the team member that's over our construction project does these group meet texts about what to expect, or hey, this part of the parking lot's closed. And people can opt out. They don't have to look at that. But if you're off for the weekend and it feels really less stressful to know what happened with the construction over the weekend, you have a way to do that without logging on to anything work related. You can just turn on your group meet and see those messages. So it helps people feel safe and like they know what's going on. Having time to celebrate, whether it's a cowbell or whether it's a party for Employee of the Year, but those moments where we come together to recognize the hard work that we do. The Body Meets the Score is one of my favorite books, and it talks a lot about just the need for celebration, even 5 or 10 minutes, to release stress physically from our body, that we need spaces to do funny activities or dance or sing together. Fostering friendships. We do a lot kind of off script around encouraging departments to meet up after clinics or to do things together. We let all the departments use our facility to host baby showers anytime there's pregnancies. It's not Good Sam planned or paid for. It's potluck style, but everyone knows that like the community room after clinic is open for you to celebrate each other in whatever way your department plans. And then I think one thing that's been really cool to belonging is that all of our staff are given the option to have an automatic donation from their paycheck if they want to donate to Good Sam. Almost all of our employees are donors. That is an incredibly powerful thing to say to a donor. And I know, because I see the financial reports, that for some people this is $5 a month, right? But that is huge. They are investing in the vision of our mission. And because of that, they end up on our donor list. And they get the newsletters and they get the donor emails. And so they also get to see that perspective of how Good Sam values them as a staff member and a donor. So they're getting double that communication. So last final tips of my, and I know we're right at 5, this is the last one, is that leadership does need to set the tone. But I'll put a caveat in here, is that if you are feeling like I care deeply about this and I'm not sure my leader of the organization does, is that so much staff culture can also be a place where leaders emerge without titles. Our account manager prays for more employees. She's our accounting, right? Our bookkeeping. She prays for more employees than anyone else in our building. And we bring that up on her evaluation. Like that is part of who she is. And we protect her time for that because God's gifted her in that way. And that's a beautiful thing. That we need to create space for fun and decompressing. That sometimes that in itself is productivity. That people need to unleash that trauma, and we need spaces to do that in community. And that once in a while, when we're really feeling like we need some new ideas about how to honor and care for our staff, one thing that's been helpful in me, and again, I'm at a clinic where we fundraise most of our budget, but I step back and I think, what if I saw my staff as our donors? Or as our biggest supporters? Because at the end of the day, they are the most important piece of how we do the work that we do. And thinking about, let's apply that lens as generating some more creative ideas. So I realize we've probably go a whole nother hour. I appreciate just your energy and your thoughts on this, and just the care that you all have for your staff is really incredible. This is my email. I love to make CCHF friends. So if you have ideas on how I can do my job better, I would love it. But if you also are in Atlanta or just want to connect in any way, I'd love to meet you and do that. Thanks, everybody.
Christian Community Health Fellowship exists to encourage, engage, and equip Christians to live out the gospel through healthcare among the poor and marginalized. If you enjoyed listening to CCHF Talk, make sure you follow, like, and share on Apple Podcasts, Spotify, Deezer, or wherever you find your favorite podcasts. To learn more about Christian Community Health Fellowship, visit cchf.org and follow us on Instagram, Facebook, and YouTube. Join us next time for another episode of CCHF Talk.